This is University of Plymouth, what I received last year. This is the offer letter that I received for Bachelor of Medicine and Surgery after my interview. So I hope you guys enjoy this video. This video is about all the interview tips and all the things that I came across in my last Plymouth medical interview. I hope you guys enjoy the video. Best of luck for everyone. And this is my first video in 2024, and I hope you guys have a wonderful year this year. All your dreams may come true. So welcome back to my channel. My name is Ravisha Fernando. Today I will be doing a video about my Plymouth interview of medicine that I've set last year. I hope you guys all enjoy the video. Please don't forget to subscribe, comment, and share my YouTube channel. Uh, so let's get into the video. So talking about my last year Plymouth interview, the interview was on Soup platform. The interview is roughly like about full interview is like 55 minutes. It is about like registration, you got your passport or driving license. uh, so roughly it's about like 40 minutes interview. So and it is an MMI style interview, so multiple mini interview. So there will be each station, and there will be different assessors for each station. So make sure that you are just make sure, if you think you haven't done really well in one station, you have a better chance to do it in the other station. So just take one station at a time. Don't panic if you think you haven't done well in this station. Make sure that you are not panic to the next station, so uh, you have more chance to do well in that station. So the first question that you could get asked is, from my perspective, every medical school can ask this question, and Plymouth will definitely ask this question from you guys. So make sure to prepare really well for this question. And this question is, why medicine? Why do you want to study medicine? Why this course? Make sure that you have a really good answer, at least like 3 to 4 minutes, that you can have a good really answer. Make sure to include all the points. So why do you want to study medicine? You have written your personal statement, and you could include tips from your personal statement. You can always explain them after you have done your work experience that made sure this is the right career for me, and include a bit of your work experience definitely in your why medicine answer. So that shows that this candidate is really want to study medicine, and he has seen that experience during his hospital or GP work. So that makes sure that the candidate is ready to do what's coming next, and like why exactly the candidate wants to do medicine. So make sure you relate your work experience to the why medicine question. The interviewer will really like that. So definitely prepare really well for the why medicine question. uh, so another question that they could come across is, describe me an example of where you demonstrated communication skills. So in this type of question, you have to make sure that you have done any sort of communication with anyone. It shouldn't be hospital or GP placement. Any example that you have come across in your life, you could use it as an example. Why do you think communication is important? And you could get that back to that, when you did your work experience. You can say, I saw how important was the communication between healthcare professions. So like that, always relate that back to medicine, so they know that you have an idea about how how is how what is medicine, what is behind medicine, how does healthcare professionals work together, and communication is one of the key aspect in medicine. So teamwork, as you know, uh, in medicine you work as a team. As you may know, MDT, multidisciplinary team, all healthcare professionals work together as a multidisciplinary team for best patient outcome. And make sure and you use an example where you worked in a team and relate that back to medicine. uh, so like I always said, it doesn't have to be a example from your placement or GP. Just make sure that you it's from anywhere that in your life. Then make sure that you relate that back to medicine. uh, so the an interviewer could ask you, how do you cope with stress? So make sure you have a really good answer for this, because medical school can be really tough, and they want to see that if you are able to cope with it. So make sure you have a really good examples prepared for this as well. Like uh, give an example where you have faced a really tough situation and how did you cope with it. So that gives you that gives them an idea that you have been in tough situation and you have coped with it. Or you can say that you do other extracurricular activities to cope with stress, like reading books, listening to music which relaxes you, talking to people if you have anything. So make sure you have a really good answer prepared of to how do you cope with stress. Is why did you choose Plymouth? Why not other universities? So make sure you have a really good answer for why did you choose Plymouth. Make sure to go onto their website and look in their curriculum or module, what are the things they offer during in the medicine course, and what are the benefits that you can get, and that's why you choose Plymouth. So make sure you have a really good idea if they ask why did you choose Plymouth. uh, Another question that they can come up with is like, what made you what made you choose to apply for medicine but not nursing? So make sure that you don't underestimate what are the things that nurses do, because the nurses do a really good job. Don't ever say nursing is not good. uh, Always make sure that you respect their career, because nurses do a really tough job in healthcare settings. They are the most uh, nearest people to the patients. So make sure you don't underestimate what do nurses do, and then include more benefit or points that why do you want to become a doctor. So make sure that question could come up as well. There could be also like ethical question they could ask. So make sure you know the four pillars of medicine, which are beneficence, non-maleficence, autonomy, and justice. And if they tell you to give an example where you showed this, make sure you can relate that in a place you worked in a hospital. So or in a GP, make sure you have an answer for that, about making sure that four pillars are, you got an example for that. uh, it's not necessary, but just to have an idea, it's always better to know the four pillars and have an example just in case. uh, they could ask you scenarios like, just from my perspective, let's say there's a patient, a girl who is 15 and she's pregnant, and she doesn't want anyone to know about this situation. And what would you do as a doctor? And in this case, patient confidentiality is also important. And but she's 15 and she's a minor as well. So in this case, how does a doctor handle the situation? Make sure you include all the ethical dilemmas or scenarios, and always make sure you work in best patient favor, so to provide best patient coordination. So those type of questions could also be asked. There's a patient has arrived to your hospital, and he's in an emergency situation and he needs a blood transfusion. And some cases, and this patient is a Jehovah Witnesses patient, and Jehovah Witnesses patient, the Jehovah Witnesses as in their law, they refuse blood transfusions. So in this scenario, what would you do as a doctor, and how would you discuss with this patient, uh, and make sure that always you take the leadership as a doctor, and then discuss within the MDT team, and then you do what's best for the patient. So these type of questions could also come up. Another question that they could ask is, what are your strengths and weaknesses? And you need to mention, just mention always, everyone has weaknesses, and it's don't be afraid to mention them, and make sure what do you do better to make sure that uh, you build up on your weakness to make it your strength. So mention your weakness and tell them how do you make sure that you are getting out with that weakness, and always mention your strength. Why do you think you are, why do you think, what separates you from other medical students? Give your strengths, uh, give them examples, make them feel unique, that you are a unique person, you are here for a reason. You know your personal statement, what you have written in your personal statement. They could ask you all some one or two things that you have written in the personal statement, but or they could not ask you, but just in case, make sure that you know what you have written in your personal statement, so you are not worried about if they ask any question from there. uh, and one more important thing that is like, during your interview, I know it could be really stressful and it could be scary for the people who are doing it as your first interview, uh, and as it is in Zoom, you need to make sure that you are not scared or stressful, because the interviewer will see if you're stressed, and that's not what they're looking for as a medical student. So make sure you are not stressed at all. Just be relaxed, be calm. uh, Everything will be okay. Just make sure, like I said, the first question that they're gonna ask is like why medicine question. That's gonna be definitely come. And other questions that I mentioned, they could come also as well, but I'm not too sure because every year it changes. But basic things like communication, teamwork, leadership, integrity, reflection, motivation, all those things, make sure you have a great example prepared, and give an example what did you see in your work experience as well, because they always want to see if you are reflecting it back to medicine. uh, so those type of things, and like I said, prepare really well. Preparation is the key. uh, Talk with your family, friends, like always record yourself in front of a camera. uh, Prepare asking questions, and if you really prepare well, then you should be really fine. And if you cover all the things that I said, you should be really good to go on your interview. So, and more resources that I wanted to mention is Medic Mind. Medic Mind is really helpful, and I highly recommend you to at least get 5 to 10 hours from Medic Mind. And you can choose your own medical tutor from each university from Medic Mind, which really helped me to get the Plymouth offer for medicine. So I hope you guys all enjoy the video. If you have any questions, please feel free to message. There's my Insta on my description, and I will attach another link down below. When they have sent you an email for your Plymouth interview, they have said a link where you can see like other people asking practice questions, prepare how do you prepare for the interviews, what type of questions they could ask. They have a link down there. I will attach it down in the description. So again, I wish you best of luck. Please be relaxed, chilled, everything will be fine. And remember, if one station doesn't go really well, make sure you don't carry that stressful stress into the other station. The other station will be a new station, it will be a new assessor. So make sure each station you act really well, and all the very best in your interview. uh, Please guys, don't forget to subscribe and comment down below. I hope you all guys enjoy the video. Thank you.